Welcome to the live session on OBA for Nepali nurse, graduate in 3 years, 4 years, BSc Nursing in Nepal. Presented by me, it's Srihari Nepal, from Melbourne, Australian time, 11 p.m. AST. This all information is copyrighted by Advice Education and Visa Services. Let's go to the Advice Education and Visa declare this live session is for information purpose only. It's not a legal or migration advice. Today, we'll be discuss what is OBA, how to prepare, NCLEX, OSCE, visa option, common mistake, and Q&A session. Who needs OBA for? We talk about who needs OBA, especially who completed nursing from Nepal. Qualification doesn't match Australian standard. AHPRA assessment letter said you are required to complete the outcome-based assessment OBA. So you are the one who need that. Understanding the OBA pathway. AHPRA IQNM, सबै नेपाली नर्सहरू IQNM अन्तर्गत पर्छ, इन्टरनेसनल क्वालिफाइड एन्ड नर्स र मिडवाइफी. फर्स्ट तपाईँले भनेको सेल्फ चेक गर्नु पर्यो. AHPRAको वेबसाइटमा गएर सेल्फ चेक गरेपछि वेयर आर यु एन्ड आर यु एबल टु गेट अ क्राइटेरिया अर नट. ओरिएन्टेसन मोडल हुन्छ 1 and 2 त्यो गर्नु पर्यो. पोर्टफोलियो एसेसमेन्ट हुन्छ त्यो गर्नु पर्यो र NCLEX-को MCQ एक्जाम दिनु पर्यो. OSCE को एक्जाम दिनु पर्यो. त्यो सबै कुराहरू गरेपछि अनि यु गोना बी registered for the AHPRA. Let's say who can apply. If you are did PCL nursing in Nepal, BSc nursing in Nepal, you are eligible. You must register with the Nepal Nursing Council, NNC. तपाईसँग as a valid passport and academic document चाहियो. That means transcript भयो ती कुराहरू. मेरो English language requirement, also AHPRA PET, TOEFL IBD, or Cambridge, whatever English language validated that you need to do. Want to work in registered nurse RN and enrolled nurse in Australia. After that, you're gonna be registered nurse for the Australia. Let's see the steps. How you gonna steps works. First step gonna be self-check, AHPRA portal. You have to go to the AHPRA website and you gotta do the self portal. Then you can see we can help them. We can help you, but हामी त्यसमा तपाईहरुलाई हेल्प मात्रै गर्न सक्छौं र हामीले लगइन गर्दिन त्यो केही गर्न मिल्दैन. अनि तपाईहरुले त्यहाँ आफ्नो क्वालिफिकेसन र डिटेलहरु हाल्नुहुन्छ अनलाइन. अनि त्यसपछि तपाई स्ट्रीम बी तिर जानुहुन्छ किनकि तपाईको क्वालिफिकेसन इक्विभ्यालेन्ट दिन चाहिँ AHPRAले यु हैव टु डु द OBA भनेर त्यही असेसमेन्ट गर्छ र त्यही अनुसारले तपाईको रजिस्ट्रेसन हुन्छ. स्टेप 2 मा भनेको IQNM को ड्याशबोर्ड रजिस्ट्रेसन हुन्छ जहाँ तपाई इन्टरनेसनल क्वालिफाइड नर्स र मिडवाइफ हुनुहुन्छ. तपाईले सबै डकुमेन्टहरु क्रिएट गर्नुहुन्छ AHPRA को वेबसाइटमा. एज अ तपाईले OBA को लागि लगइन आईडी बनाउनुहुन्छ. तपाईको इमेलहरु सबै भ्यालिडिटी हुन्छ. त्यसपछि यु गना अपलोड डकुमेन्ट, पे द AHPRA fee and wait for the assessment. The AHPRA fee going to be around $640. Let's go to the minimum English language requirements. That means when you got a 2 sitting in 12 months period, all academic 7 overall score, listening 7, reading 7, speaking 7, writing 6.5, and you got a 2 sitting stand, means within a 12 months you can sit twice and get a combined result. And PD is same as 66 overall, listening, reading, speaking and writing, 2 sitting no less than 56 any component. OET be overall score, listening be, reading be, speaking. Mostly कति नर्सहरुलाई PD मा गाह्रो छ भने OET पनि अलिकति सजिलो हुन्छ, मेडिकल टर्मिनोलोजी बढी हुन्छ भन्ने कुराहरु मैले सुन्नमा आएको छ. Sorry guys, I never been OET. I gave to PD and IELTS a long time ago, almost 7-8 years ago. After that, I haven't done anything. Cambridge, C1 Advanced and C2 Proficiency overall score. Listening 185, reading 185, speaking 185, writing 176, 2 sitting. यो बाहेक भनेको यति नै तपाईँको मेनली अब तपाईँको नर्सिङ भनेको मेनली इङ्ग्लिस ल्याङ्ग्वेज स्पोकन कन्ट्रीमा भएको छ नि द्याट्स द डिफ्रेन्ट स्टोरी स्टेप 4 NCLEX-RN अस्ट्रेलियन पर्सनको इक्जाम दिनको तयारी गर्नु होला र आउटकम बेस्ड एसेसमेन्ट रेफरल लेटर दिन्छ र 70 to 145 क्वेसनहरू हुन्छ NCLEX-को लागि र पियर्सन भिओ सेन्टरमा NCLEX-RN टेस्ट नेपालमा दिन मिल्दैन त्यस कारणले गर्दा मैले यो लेखिदिएको हो You have to go to India, nearest Indian Pearson View Center, New Delhi, Mumbai, Hyderabad, Bangalore, Chennai. Already, if you already pass for the NCLEX for the US version, you're still valid for Australia. For the new, what is NCLEX? NCLEX knowledge exam, computer-based MCQ exam test, and nursing theory, clinical judgment, safety and prioritization. You have to pass NCLEX to go to the OSCE. Step 5 को कुरा गरौँ हामी स्टेप 4 बाई स्टेप 5 मा जाँदैछौँ स्टेप 5 मा OSCE भनेको के हो भन्दा एज अ फुल फर्म objective structural clinical examination. It's a practical examination gonna happen in Adelaide and Melbourne, conducted only in Adelaide, South Australia, Adelaide Health Simulation, or Melbourne, Victoria, or the Royal Australian and New Zealand College of Obstetrician and Gynecologist, RNGCUG. That's they're going to have the simulated hospital environment. What exactly you do in the hospital, that's going to be. Medication administration, one care, communication, documentation, emergency response. This is the most important. This is very important states for your OSCE. Apply for AHPRA registration. After passing NCLEX-RN National Council, NCLEX National Council Licensure Examination for Registered Nurse RN, त्यही अनुसारले EN को हुन्छ र midwife को त्यही अनुसारले हुन्छ OSCE भनेको objective structural clinical examination भनिहाल्ने मैले you can apply for registered nurse and after registration you work legally anywhere in Australia and you start good life. Step 7 orientation part 2 हुन्छ after registration focus on the Australian professional practice, cultural safely, Aboriginal and Torres Strait Islander healthcare को बारेमा orientation 2 मा हुन्छ. After that step भनेको हजुरको skill assessment हुन्छ NMC Australian Nursing and Midwife Accreditation Council ले त्यो skill को कुराहरु गर्छ त्यस पार्टमा हामीले हजुरहरुलाई गाइडेन्स र हेल्प गर्न सक्छौं र हामी मार्फत त्यो गर्छौं. Timeline for Nepali nurse, especially Nepali stages self-check assessment 1 to 2 months, portfolio approval go 1 to 3 months लाग्छ, NCLEX preparation exam 1 to 3 months लाग्छ, OSCE preparation exam 2 to 4 months, registration approval 1 to 2 months, total 6 to 12 months हामी tentative कुरा गरौँ. त्यसपछि next हामी estimated cost पैसा कति लाग्छ त how much going to be cost. Self-checking is free. From AHPRA NMBA website, you can do yourself. IQ NMBA assessment and orientation fee gonna be $640 by AHPRA, Australian dollar. And NCLEX-RN exam को लागि $350 USD हजुरले तिर्नुपर्छ PSN POE मा. र OSCE exam को लागि $4,000 you have to pay. And initial application and registration $475. AHPRA ले charge गर्छ to शीर्षकमा. NCLEX preparation online गर्ने हो भने नेपालबाट हजुरले $1500 तिर्नु पर्यो 24 weeks को एक्सेस हुन्छ हजुरलाई 24 weeks मा गर्न सक्नुहुन्छ. OSCE preparation गर्नको लागि 2 weeks को intensive course हुन्छ in a person अस्ट्रेलियामा हुन्छ त्यो 2700 लाग्छ 2 weeks को हजुरलाई. NCLEX र OSCE total combine गर्नुहुन्छ भने 4200 to 6000 लाग्छ जुन चाहिँ अनलिमिटेड एक्सेस हुन्छ. र नेपाल र अस्ट्रेलियाको टिकटको कुरा गर्दा टु वे टिकट 1200 normally. Accommodation तपाईलाई 1 month को लागि 500 to 1000 like so tentative. That is, this cost is only for the estimation. It's not the real. It might be different up and down for the real cost. Why Australia is the best for Nepali nurse? I'm like Australia best. Why? It's very high demanding nursing here. Competitive salary. Employer sponsors a visa 482 186. Permanent residency pathway. Safe work environment and strong Nepali community. तपाईँहरूको स्पोन्सर भिसा र पर्मनेन्ट रेसिडेन्सीको बारेमा चाहिँ हाम्रो माराले तपाईँहरूलाई एडभाइस दिनुहुन्छ. आई एम नट क्वालिफाइड फर टु गिभ यु द एडभाइस फर द्याट टपिक्स एक्सेप्ट एनिथिङ. How advice education gonna help us as a nurse from Nepal to here? We support Nepal nurse from Nepal to Australia with AHPRA self-checking guidance, portfolio and document preparation, English test advice, NCLEX and OSCE preparation referral, visa strategy, visa, student visa, and job ready guidance. These are the things we're gonna happen. And then important tips for success: English preparation, start early, NCLEX pattern exactly understand, which examination skill class improve, documentation for AHPRA requirement, avoid wrong agent and misinformation. Consistency is the key. You have to practice daily. If 3 years bachelor who is not eligible, we have an option: graduate certificate in advanced nursing, requirement completed, a bachelor of nursing degree, equivalent qualification, 3 years diploma of nursing, leading to registered nurse. These are the pricing: $8,000 you have to pay. The course intake is as follow. अरू डिटेलको लागि हजुरहरूलाई चाहिन्छ भने हामीलाई इमेल गर्नुहोला oba@adviceeducation.com. You can do WhatsApp +61 468 205035. Thank you very much. Anything you gotta ask, please ask us. I will definitely do that. Thank you.